Hey folks, my name is Dr. Magadi. I'm the infectious disease specialist here at the Regional Medical Center. I'm the chairman of infection control, and I'm also the director of pandemic control, pandemic response team at the hospital. One of the questions that have been often asked is as far as female fertility with the vaccine. I think that idea that it might alter your ability to reproduce, or the fertility issue, is mainly brought on by social media. There's no scientific study that proved that it could really do that. So it's basically a creation of social media. So let me just dial down on the actual kind of basic biochemistry or biology or cellular immunology of the vaccine. The vaccine, mRNA, especially mRNA platform, it uses the specific genetic material called mRNA to produce antibodies against spike glycoprotein. Spike glycoprotein is a protein on the coating of the coronavirus, and that spike glycoprotein has a very there's a lot of amino acids, and several amino acids kind of share the same amino acid as the protein found in the placenta called syncytin-1, syncytin. They're not even close. So the protein that they're talking about that is produced in the placenta called syncytin-1 has about 5 amino acids that it's similar to the glycoprotein. You know, the most glycoproteins or any specific protein has thousands of amino acids. So that, saying that it's probably similar because it has 5 of the thousands amino acids, that's really a stretch. So we could get a protein, a specific protein, and another protein. They could have similar amino acids there, but it doesn't mean that these proteins are the same. To be able to get protein, you have to have thousands of amino acids, and from what I read, syncytin only shares about 5 of them with the spike glycoprotein, so it's definitely not even close. So the ability to reproduce will not be impacted with the COVID vaccine. Case in point, during the clinical trials for Pfizer, which involved about 35,000 volunteers all over the world, including the US, and the clinical trials for Moderna, which involved at least 32,000 volunteers exclusively here in the States. Some of the volunteers actually were women of reproductive age, and several of them actually became pregnant and eventually delivered healthy babies. So that really kind of debunks that myth that it's going to alter my ability to reproduce or become pregnant.